Good morning. My name is Dominique Damian. I am a safety director with Washington Farm Bureau. And today we're going to talk about outdoor heat exposure and wildfire smoke for employees. To get started, we're going to talk about outdoor heat exposure. But before we get started, if you have any questions, please put it in the Q&A and we'll monitor that as we can. We are fulfilling the requirements of the new wildfire smoke rule and the updated heat-related illness rule. However, there are some supplemental things that employers are going to need to provide to employees, like the method of communication and who to report symptoms to, where your water is stored and where your shade is. Okay, let's get going. We're going to kind of go through this kind of quickly because we're fitting it into 30 minutes, but this is recorded. So if you need to revisit it, it will be available in the next day or two. All right, so heat-related illness can be very dangerous. And it can begin discreetly. It might start with some heavy sweating, which can be expected, maybe some dizziness, a headache, and some weakness. Then you may experience some muscle cramps, some nausea or vomiting. Without treatment, heat-related illness can lead to more serious conditions. So if the skin becomes hot and dry, or confusion sets in, or the heart beats rapidly, or breathing becomes quick and shallow, you are now experiencing heat stroke, which can be fatal. Your employer will closely monitor employees, but it's important for employees to monitor themselves as well. Pay attention to yourself and your coworkers and report symptoms early. As temperatures rise, the risk of heat-related illness increases. Under the new heat safety rule, employers must take specific steps to protect their workers when temperatures reach these thresholds anytime throughout the year. The threshold temperature depends on the type of clothing that employees are wearing. So if you are wearing some non-breathable clothing, like in this picture, if you're spraying pesticides and wearing a chemical resistant suit like this, when that temperature reaches 52 degrees, you may be susceptible to some heat-related illnesses. All other clothing, the threshold sets in at 80 degrees. This does not apply to incidental exposure. So if you are exposed to these temperatures for 15 minutes or less in an hour throughout the day, in any hour throughout the day, this rule does not apply. Environmental risk factors contribute to the risk of developing heat-related illnesses. Environmental risk factors include temperature, obviously, humidity, clothing, personal protective equipment or PPE, the workload, or the work duration. Personal risk factors also increase susceptibility to heat-related illnesses, including but not limited to these here. So age, physical fitness, acclimatization that we'll talk about here in a minute, any medical conditions, hydration, alcohol use, prior heat-related illness, pregnancy, or medications. This information is for your use only, not necessarily for the employer. So that's why it's even more important as an employee, you're monitoring your own health. Acclimatization can take up to 14 days. So it might take 14 days for you to get used to the heat. And then it gets lost after 7 days of absence. So very much like this spring that we're having now, we might have a hot day one day or a couple days, and then we're back down to 50 degrees. We're not going to be acclimated the next time it reaches, 90 degrees in Eastern Washington this week. So it's important to understand that you might need to ease into the work that you're doing as you're getting used to the heat. Employers are required to closely monitor employees during this period of time. So ask your employer how they plan to closely monitor you. That might be something like a buddy system or two-way communication. To prevent heat-related illnesses, here are some prevention methods. First of all, take breaks when you need to. These breaks are required when temperatures reach 90 degrees or more. At 90 degrees, a 10-minute break is required every 2 hours. And at 100 degrees, a 15-minute break is required every hour. But take breaks as needed, just communicate with your supervisors. The purpose of these breaks is to cool down. Employers are required to provide shade or something equivalent like air-conditioned vehicles or misting stations. So at this point, when you're taking a break, make sure you're removing any extra PPE or extra clothing that will help the cooling process for your skin to be able to evaporate the sweat off. This is also a good time to hydrate. Staying hydrated may be one of the most effective ways to prevent heat-related illness. And then acclimate to the heat by easing into the workload. It may take up to 2 full weeks, remember, to fully acclimate to the working in heat. So gradually increase your work duration or the workload while you're building up the tolerance. One of the new requirements is that the employer must provide shade. That might look like a pop-up tent here in the middle. It might be a big tree, as long as there is enough shade for employees to sit comfortably during their breaks. It might be a misting station, or it might be an air-conditioned vehicle. If you are planning to use an air-conditioned vehicle, just make sure you do have the air conditioning on during breaks. Employers are required to provide water that is suitable to drink and suitably cool in temperature. Other acceptable beverages include sports drinks, as long as they don't have enough sugar or don't have a lot of sugar or caffeine. However, alcohol is not, soda is not, water from a hose is not. It must be drinking water only. And lastly, about heat-related illness, supervisors are required to have some additional training. So supervisors need to know what the procedures are for communication to and from employees. Make sure there's two-way communication. We want to make sure that employees are heard when they are experiencing symptoms and might need medical attention. They need to know what the procedures are for monitoring employees, especially during acclimatization periods, and what the emergency response is. So what is the plan if somebody does show signs and symptoms, and when to transport employees when it's needed. And then also the importance of engineering controls. Engineering controls or administration controls are things like air conditioning or scheduling work during different parts of the day where it might be a lower temperature. All right, now we're going to flip over and we're going to talk about wildfire smoke. Wildfire smoke is the emissions from fires or wildlands in adjacent areas. It's comprised of a mixture of hazardous pollutants like particulate matter, volatile organic compounds, water vapors, and other gaseous chemicals. But we're going to focus on the particulate matter. That's the main component of wildfire smoke. It's about 90% of what wildfire smoke is made of. So the new regulation focuses on this. We're talking about particulate matter, so small particles or droplets, liquid droplets that are very, very small in size. And this picture just kind of shows the in comparison. So a human hair is 50 micrograms. We're looking at 2.5 micrograms. So what does the employer need to do? The employer needs to identify harmful exposures by monitoring the air quality. They need to communicate the hazard when air quality becomes hazardous, and inform and train employees on the health effects of wildfire smoke, the right to obtain medical attention, how to obtain air quality information, the requirements of the rule, the importance, benefits, and limitations of respiratory protection, and the use and care of respiratory protection. And we're doing a lot of this today. There are a few things that the employer is going to need to continue, like where the respiratory protection is provided, where the employees can pick up respiratory protection, how employers are going to communicate and how employees can communicate back to employers, and what they're going to do for an emergency response. So the potential health effects of wildfire smoke after doing some research. This is what L&I has added to the rule that employees need to know. Wildfire smoke can cause coughing, excess coughing, increased phlegm, wheezing, difficulty breathing, reduced lung function, bronchitis. It can aggravate asthma. It can cause heart failure and may lead to early death. L&I implemented the new regulation on January 15th of this year. So that's why this training fulfills most of that requirement. To simplify things, so we're not talking about particulate matter in micrograms per meter cubed. L&I added an equivalent to what the AQI is, where we can find a lot of this on several different websites that we're going to talk about next. But to give you an idea of what that looks like, particulate matter we're measuring in, we're talking about PM 2.5, particulate matter with a diameter of 2.5 micrograms, measured in meters cubed. I'm getting pop-ups at the moment. Sorry about that. And then the AQI is a unitless index that the EPA came up with. So we're correlating what the concentration of PM 2.5 to an easier unitless system of AQI. It's not a direct link. These health statements here on this chart are for public use, not necessarily occupational use. It's just an easier way to read air quality when it comes to wildfire smoke. However, the AQI doesn't include just wildfire smoke or particulate matter. It does contain other hazardous contaminants that whatever's the highest. So make sure when we're looking for concentrations, we are making sure that the PM 2.5 is what's registering that AQI, which it will show you on the websites when you go to them. And here are the websites we're talking about. So your employer will be monitoring air quality using one of these methods. You can do the same. Understand that the monitoring equipment may be far from where you're located. So it might not be the most accurate, but this is the best that we can do at the moment. These are some of the controls that your employer may implement. So if possible, moving workers into enclosed buildings when wildfire smoke gets to be too bad, or vehicles, providing portable air filters in enclosed areas, possibly relocating work. So air quality changes very quickly, and depending on where you're at. So being able to relocate work from one space that has a higher air quality to higher air quality number to somewhere with a lower AQI. Or rescheduling work. So if they know that during the morning it's going to be a better air quality, then you might reschedule work. You might reduce work intensity, so reducing the workload so you're not breathing as hard. Providing rest breaks, and then if nothing else, providing respirators. Respiratory protection can be effective when preventing the symptoms of wildfire smoke exposure. However, there are adequate respiratory protection and there's inadequate. So surgical masks, bandanas, scarves, and t-shirts do not provide enough protection against those very small particles. And now I have on here KN95s are allowed. They are not allowed any longer. I need to take that off this slide. KN95s are not NIOSH approved, which is a requirement for respiratory protection. So what the rule says now is that you must be provided an N95 respirator or better. So if you're using an N95, you don't have, as voluntary use, you don't have to go through the medical evaluation, the fit test, or anything else. However, if it gets to be required, you do have to go through that. If you use an elastomeric respirator, like in this picture here, you do have to at least have a medical evaluation. And here are the thresholds within the regulation. So lots to go over right here. When the air quality index hits 72 degrees, or 72, sorry, not degrees, or 20.5 micrograms per meter cubed, employers are encouraged to provide N95s. When it hits 101, they are required to provide. So that means that they may have them in an area that you can pick up whenever you feel necessary. If it gets up to 351, the employer is going to have to directly distribute those respirators to you, those N95s to you. And then when it gets up to 849, it's got to be more than that. You have to have it's now required to wear a respirator. So up until 849, you have the option to wear it or not. It will be encouraged. When the air quality index hits 849, it's now required to wear a respirator, and there are some additional requirements that go with that. So you're going to have to go through and have a medical evaluation and a fit test, even if it is just an N95. When it hits 957, it's no longer an N95. You have to at least wear a full face respirator, and you have to have a quantitative fit test. And to put on a respirator properly, to don the respirator properly, if we're talking about an N95, which is going to be the most common, put the mask over your nose and your chin with one strap placed below the ears and one strap above. Pinch the metal piece on the nose if there is one, and then perform a seal check. So that just means covering your respirator and exhaling. If you feel an air leak, then the respirator is not fitted right, and try to adjust it. Replace the respirator if it gets damaged or deformed or dirty or difficult to breathe through. The filtering face piece respirators or the N95s are disposable, so they can't be cleaned or disinfected. Just replace that when you need to. And that is it. So if you have any questions, now's a good time. Remember to put it in the Q&A so we can monitor that. I don't see any at the moment. Here is our contact information. I'm Dominique. I'm out of the Lacey office. Jeff Lutz and Luis Isidora are on the east side of the mountains. Here's our phone numbers and our email addresses. This is recorded, so we will have that available upon request as well. Okay, I'm not seeing any questions, so thank you for attending today and have a good rest of your week.